Tommy.
Hello, everyone, and welcome to, I guess, what we're calling Tommytown Television, TV. It's 2:30, and I'm here with former town meeting member Frank Friedman, but more importantly, emergency room Dr. Frank Friedman. And you won't be surprised to hear we're going to talk a little bit about COVID-19. Before we talk about the medical issues, I do want to give a quick recap of things that have happened in the last several days. Of course, Monday morning, the governor closed non-essential businesses, and that has been a process and has been complicated, but we're on our way there. And of course, it's resulted in people finding themselves more easily able to keep their 6 feet of social distancing. And that's really, really important right now. The way that I've been thinking about it is because it's spring and we're thinking about baseball. When you sit in the outfield at Fenway Park and you watch the game, you see the batter before you hear the batter hit the ball, because the light travels faster than sound. And in a sense, that's what's happening with COVID-19. The actions we take now, we will not see the results of for 7 or 14 days, right? The things we do now, we don't get to see the consequences of until later. And we have to believe the science and believe the medicine when they tell us that this matters. We're not going to see the results right away. And so even though we're taking these strong actions now, we're going to continue to see infection rates that are terrifying. And we need to give time for these infection rate data to come through. And that might be for another week or two. And so it's really critical that you continue your social distancing, you continue to wash your hands aggressively, I'll say. You continue to be of sound mind and body, but not too close to people who don't live in your own house. So in addition to the governor closing non-essential businesses on Monday, in fact, yesterday he announced that public schools will not reopen April 6th. Indeed, they will remain closed until early May. That's both public K-12 and child care centers. So we're in this all the way through the month of April into May. And that's, as the father of a 9-year-old and a 5-year-old, that's still sort of settling in for my wife and I. But we're going to be fine. Our kids are going to make it, and we're going to do our darndest to not get sick. 2 other things I want to mention. The RMV is essentially appointment only. If you have an inspection sticker that's due, you're going to get a 60-day extension. If you have a driver's license that's due to be renewed, you're going to get an extension. So please go to the website first, if that's available to you. If not, pick up the telephone and call first. Almost certainly you don't have to go in. And if you do, they're doing appointment-only model so that they can maintain spacing and distancing at the RMV. Finally, it has been reported that 2 Brookline firefighters have tested positive out of the Babcock Street station. Several others are showing symptoms and have taken tests, but those results haven't come in just yet. And so essentially the entire Babcock Street delegation, if you will, are quarantined until they've got it settled down. And the other firefighters didn't waste any time immediately offering to cancel their vacations, to work overtime, to do a little more to make sure that we have that coverage. So thank you to those Brookline firefighters and to the ones who are sick. We wish you a speedy recovery. Now I'm finally getting to the exciting time, I think, which is to talk with my friend Frank Friedman. We got to know each other in town meeting, and Frank spends most of his time these days at Tufts. Tell us a little bit about what you're doing and what you're seeing before we got into COVID.
So I'm a full-time emergency physician at Tufts Medical Center in downtown Boston, where we see cradle to grave. We have a full-service emergency department with a pediatric emergency department and adult services. We're also New England's first accredited level 1 geriatric emergency department. And we've been preparing for pandemic scenarios for many, many years. It's sort of always been a question of it's not if it will occur, but when it will occur. We just got a little curveball with this. While everybody used the Spanish flu of 1918 as a model for what could happen, we also, especially since 9/11, have always assumed that whatever infectious disease pandemic occurs would be some sort of bioterrorism, something with anthrax or equally scary. So that might be a tiny bit of a silver lining with this, that is a coronavirus, which, although this one is certainly more severe than common influenza, more deadly, it's still not nearly as deadly as some of the other possible infections out there. So if there's a little bit of a silver lining, that might be it.
Could be worse.
In emergency medicine, we say it can always be worse.
Yeah. I'm more of an optimist. Can you tell us what's the emergency room been like this week, and how are the folks who practice medicine, the people who wear the blue pajamas, as I like to think, how they're feeling and how they're responding?
Well, everyone's anxious. It's especially bad when, the threat is something so tiny that nobody can see. And it's probably been a little bit of a blessing that it started somewhere else, and that there's been a 2 to 3 month lag time since cases first started popping up in China. So there has been medical literature and case reports and data coming out that give us some guidance. But it's also been interesting in that overall volume is down across the board by about 25% in the emergency departments in the Boston area and in Massachusetts. I've been in communication with a number of my colleagues around the state as well. So a lot of people have been staying away for some of the routine things that they would frequently come into the emergency departments for in the past, but we're definitely also seeing a significant uptick in the percentage of respiratory complaints of those who are coming in. I think most of the emergency departments, certainly the academic emergency department hospitals, have set up satellite facilities that are purely for testing both hospital employees and patients if you have no more than minor symptoms, but are concerned that you have COVID-19, have a coronavirus infection. They can do testing in that location without all those patients being assigned to rooms within the emergency department itself. And then we have all seen patients who either have suspected coronavirus infections or proven at this point, both in our ICUs and inpatient settings, and also, fortunately, a number who are not nearly ill enough to need to be hospitalized and can be diagnosed and sent home with appropriate instructions.
So I want to get to that in a minute, but I want to actually first dial back. You said visits are down about 25% across the board. And so, I imagine that's related to people are driving less. They're getting fewer car crashes. People are playing less sports. So there are fewer sports injuries, right? Is this sort of largely because people are doing less dangerous things that we sort of do every day, or is there something more to it than that?
I don't think we've completely figured it out yet. Certainly we're seeing fewer traumas, so that part of what you said is definitely true. But, the emergency department, as my former chief used to say, is the great equalizer. Everyone comes to an emergency department as a patient sooner or later. And so anything that can happen to a human being ends up in an emergency department at some point. And just across the board, we're seeing just overall decreased volume of everything that we usually see.
And that's freeing up a little capacity as the respiratory cases become more frequent. You said, and is it the case that it's not just that you're getting COVID-19 cases or what may be, but you're also getting other respiratory cases because people feel like, oh, I might be sick, I better come in?
Until we had the COVID testing on site in the hospital, and it was still a send out to the state lab with a 5-day turnaround time or a few day turnaround time. A lot of the hospitals were checking influenza swabs, and we're checking what's called a respiratory viral panel, which looks for a dozen or so common viral illnesses, including coronavirus, but not COVID-19, because coronavirus one of the coronaviruses is simple, often just simply causes a cold, but that's a different infection. And we were all, sort of chuckling at just how many other infections still abound, even when you're in the middle of a pandemic. There are other infections. A number of people who we were convinced would have it proved to have a different infection.
Well, and I have been wondering, with people taking additional precautionary measures, are all these other, what I'll call common colds, these other sort of respiratory illnesses or other things that the bug that we pass from one to another, are those substantially down because we are doing a better job?
I don't think we have the stats yet, but everyone is sort of wondering if everyone's washing their hands more and keeping the physical distancing, will we see a lower incidence in general? And I think there will be all sorts of different data that emerge in the coming couple of years or so as we finally get a chance to have some breathing room and to analyze what we've seen and what we've done.
One of the things that we've heard quite a bit about is the current or near future shortage of PPAs, right? Protective equipment, ventilators, perhaps there's other tools or things that you as medical providers feel like there's a shortage. Could you tell us a little bit about where we think we are right now, at least in the Boston area, and what, if anything, people should be doing about that?
We are certainly very concerned about supply lines and equipment of all sorts, including personal protective equipment. On the one hand, there are shortages and people are being urged to wear a mask all day as long as you haven't touched it or taken it off. There are facilities around the country, particularly in New York and other places, that are sanitizing and reusing as well, things that would have never been considered for an instant had you asked us a month or two ago. So that's part of it. But we're also continuing. So if a patient comes in often, proves to have, or you're very suspicious has a coronavirus infection, COVID-19 infection, if neither the patient nor the caregiver is wearing any protection, there's a high-risk exposure. It's also a high-risk exposure the longer you're exposed and the proximity. But if the patient is wearing a simple surgical mask, it goes down from high risk to moderate risk. And if both the patient and the caregiver are wearing simple surgical, assuming that you're not doing any aerosolizing procedure. So there are measures that are being taken, and simple surgical masks and barrier protection are more available than the more specialized N95 that everyone has now heard about and knows about.
Frank, I was just going to interrupt you because we are getting some feedback. I was just testing whose mic it was coming from. I think it's coming from your mic. It may be that you're moving your hands or have some paperwork in front of you. Just be mindful of that because we are picking up some of that noise. And for a moment, it covered your mic. So, Sorry, the last bit that you said about the N95 masks, can you repeat that?
So we're just not having to use quite as many N95s as we were initially thought we would have to. Certainly, if you're going to have for the caregivers who are having more prolonged contact, and certainly if they're doing aerosolized procedures, then there's much more careful and heavy-duty protection that's in place. But the supply chains are concerned for everybody, from what I hear around the country, especially in New York, where they're seeing so many more cases at the moment. This is a very, very real concern and something we never thought we would have to worry about in this country, but here we are.
Yeah, and there have been some efforts to make homemade masks, and I'm actually curious to know what you think about whether or not, one, those are moving in the right direction in terms of health options, and two, what sort of scale you could imagine in a production like that.
So in the healthcare setting, as the CDC has basically said, it would be a very last ditch barrier method if there was absolutely nothing else. My wife and I were fortunate enough to travel to Japan, where a number of people were wearing masks. This was before this had happened. And I was surprised. I wondered, was everyone afraid of everybody? But I learned in Japan, the practice is if you feel that you are coming down with something, you wear a mask so as you don't pose a risk to your neighbor or the fellow subway rider. So perhaps, certainly those cloth masks would be beneficial to help contain accidental droplets coming out from an individual if they were to cough or sneeze. I don't think they would provide a lot of protection for someone on the recipient end.
I see. Thank you. That's actually really helpful. We talked a little bit about testing. I know that the number of tests per day is going up dramatically, and the timeline between when you take the test and when you receive the results has come down. Can you give us a sense for who might be eligible to get a test today and maybe who wouldn't because they don't meet the criteria? And then how long before folks are really finding out whether or not they have COVID-19?
At my hospital, they went live about a week ago with in-house testing, which they are running in batches, and then the machine time, I understand, is about 7 hours to run the test. I also have read in the newspaper that there's a new test that the FDA has approved that should be going online by the end of this month or beginning of next month that actually has a less than 1 hour turnaround time. I don't know how long it will take to roll that out. For us, testing is prioritized based on the amount of difference it will make in taking care of the patient. So someone who has respiratory symptoms and needs to be hospitalized is probably at the very top of the list. Healthcare workers and first responders who you would not want to have out taking care of people without adequate protection are probably next. And then after that, it is level of exposure to others and people who are living together, people who would be at higher risk of spreading it. We have if our undomiciled population would also fall into that category. Right now, it's been a very big issue within Boston because if you are having a COVID test performed because you have some symptoms, but you don't have the results back yet, the homeless shelters have actually been barring those residents from staying in the shelter until they have those results. And there have been some measures taken to be able to at least temporarily quarantine people in tents while waiting for the results, but it has been a real issue, especially just a week ago when it was much colder than it has been now. And we certainly haven't warmed up all that much yet. So people have been scrambling to figure out that piece of the puzzle.
And you mentioned the incredibly vulnerable population of folks who don't have a safe place to stay every night. And it's certainly been a real challenge. One of the additional challenges is that everything's closed. And so there's no place to go during the day. Mm-hmm. There's no library. There's no Starbucks. There's no place to use the bathroom. And that these sort of multipliers on the impacts on health for that population is incredibly severe right now. Similarly, shelters are not quite sure what they ought to be doing. How do they make sure that they remain a safe place? Who's sick and who's not, and how to prevent sort of a mass outbreak of COVID-19 amongst that population. So it's been a real challenge. It's something that the legislature is thinking about. I'll also point out that, in fact, right now it is believed that 2 Massachusetts members of Congress likely are infected. This is not anything that's insider information. Congresswoman Presley and Congressman Moulton both are believed to have it. I think Congressman Moulton has not been tested. He's not a high enough priority because he's not showing any severe symptoms and he's home and safe. Also, State Representative Michael Day has tested positive and has been self-quarantined. As you can imagine, legislators actually do see a lot of people, and we come together to vote. So it has been a concern in the State House. We continue to vote in the State House. I was there today for some votes, but we're actually doing it in what's called informal sessions. So we don't need everybody there. As long as what we're voting on is uncontroversial and no one objects, we don't need everybody in the room. And that's how we're able to keep some business moving along. In fact, today we took some votes related to town meeting. There's all sorts of laws on the books about when town meeting has to meet and pass a budget, and it relates to a July 1st deadline that we are almost certainly going to blow through. So it's likely that the May elections, for example, will be delayed. It is likely that town meeting won't start at the date it's scheduled for. All of this is going to get pushed back, which isn't such a big deal, except that the law says we must pass our budget by July 1, and we won't do that. So that was some of the things that we worked on today. Another question, although I did want to sort of get back to medical staff. Like more generally, how are they holding up? I mean, they're used to stress. They're used to long days. They're sort of the normal. Everybody's seen a television show or a movie, so we all know that's true because we saw it on TV, right? But certainly now, I imagine both. I have two questions. One, how are the folks who are working maybe harder or in a more stressful situation doing? What about all of the medical personnel who were doing the kinds of procedures that have been canceled, and what are they doing with their time? How does that work?
So we've been trying to put into place labor pools where people who don't have their usual clinical environment in which to work can work elsewhere. We're also putting in place all sorts of contingency plans for our staffing. I've been working this past week on an additional on-call schedule and staffing scenarios if as many as 25% of our physicians are impaired by this illness for up to 14 days at a time in an optimistic scenario, and how we would change our staffing patterns in that situation. But we're also, I don't know if we're at the point yet where the orthopedic surgeons are going to be taking care of internal medicine patients and running routine things, but we've looked at all sorts of ideas of what you do, how you can best utilize the staffing and a labor pool. And certainly nurses have been shifted to the satellite clinic where they're doing testing of people coming in and they're gowned up and whatnot. And I think we're all figuring this out as we go.
And I know as a doctor, you know what I know, and that is that nurses are superheroes.
Yeah, absolutely. I'm just a doctor. I'll tell you
right.
that anyway.
You bet. What about, I've heard, I know for a fact that the state is currently looking at allowing medical practitioners whose licenses recently lapsed. For example, they just retired. Those folks are getting cleared to come back to work. And then what about the possibility of medical students or folks who are now officially doctors? They're out of medical school, but they're in one of their many years of indentured servitude, doing more. Is that on the horizon as well?
Well, I mean, we certainly saw that in Italy, where all of a sudden the final year medical students didn't have to go through graduation and their final exams. They were just simply declared as physicians and put out a little bit early. It's a double-edged sword. They'll definitely be able to assist in the labor pool, but their level of training is only so much, and their ability to function independently is only so much as well. I did see a report in one of the papers recently that a number of the medical students whose clinical rotations have been curtailed are trying to find other things to do, assisting in bathing patients, assisting in meal delivery, and assisting in even doing childcare for healthcare providers, so to free them up to be able to do what they need to do. I had a third-year medical student as a patient recently for something unrelated and minor, but I did have the chance to say, so what are you guys doing? And he said, all clinical rotations have been canceled. And I asked, well, what are they doing with your time? And he said, they haven't figured it out yet. So I think this is still, people are still adapting and changing and trying to figure out what to do best.
We only have a few minutes left. And I want to ask you a few questions that I'm sure you've heard before, and I think folks need to hear multiple times, either to really understand or even just to believe. Is 14 days enough time for recovery? How sure are we that after 14 days, you're no longer dangerous to others?
I've seen some conflicting information. I think for the most part, most of the shedding is probably, viral shedding has probably stopped. I do know that for some people, or in some protocols, it has involved then having a negative test. I'm not an infectious disease expert, so I can't speak specifically as to what the safest point in time is. But I think at this point, even at many of the hospitals, they're basically saying once one has gone either 2 or 3 days without a fever, without using any Tylenol or other antipyretic, and symptoms are mild, you can go back to work wearing a mask. So again, you're not going to shed virus on others, but it's considered that you'll be safe and not spread an infection and be a risk to others.
On the other end of the spectrum, folks trying to avoid getting infected, folks have asked questions about how long droplets stay in the air. Is it really safe to go to a grocery store, even if you're 6 feet away from everybody else? Or what about the mail? Is there the virus on the mail? Should I put it in a bag for 3 days before I touch it? What we can do above and beyond simply pretending that the hamster bubble we're all in will keep us safe?
Well, so I've seen conflicting information. While they can find so-called live viral particles on inanimate objects for up to 2 or 3 days, there also aren't documenting any cases where people are thought to have become infected because they touched a piece of cardboard. I think the common sense middle ground would be, I don't think you need to be worried about your mail. But after you've opened all your mail, try not to touch your face while you're opening it and go wash your hands afterwards. And that's probably going to be more than adequate. It's certainly not going to release particles into the air in some sort of science fiction cloud that you need to worry about. And similarly, when you go shopping, if everyone can maintain 6 feet of space between them and other people when they're in line at the checkout counter and throughout the store, I've never seen more polite people than I have in the supermarket recently. But to try to maintain safe distance, wash your hands before and after, try not to touch your face, all the basic common sense public health measures that you've been hearing a lot about. I think we'll, in that regard, people will be pretty safe in doing those kinds of things. It's proximity of exposure and duration of exposure. So if you pass someone by, that's a very, very quick amount of time.
So I want to take the last minute to do 2 things. The first thing I want to do is, remind folks that this is not a 23-hour-a-day effort. This is a 24-hour-a-day effort. And so you don't reward yourself for doing a really good job today by taking an extra trip to the grocery store because you're bored. We're all bored, I promise. But you don't need to go to the grocery store 2 or 3 days a week. You really don't. Get your food, be well fed, choose healthy options, but really make it a strong effort, right? Reach into the back of the cupboard and as I've been joking, eat that can of Manhattan clam chowder that we know you don't like, to help you go one more day before you go back to the grocery store. Similarly, with all of your other pseudo-essential or possibly essential efforts, really make an effort to not use this as your way to feel normal for an hour a day. Get on Zoom and talk to your friends. Watch us on television, call someone. You can even certainly go for a walk or a bicycle ride, keeping that distance. But really, really try to stay out of public places as much as you can. We've all heard the phrase flatten the curve. It really matters. We want to keep folks like Dr. Friedman in his PPEs, and we want to keep the capacity for medical care able to meet the needs of everyone, and that means we all have a role to play. It's so important. Please do everything you can 24 hours a day, and take the extra time to call someone, a friend, a family member who might be vulnerable, either because of their age or they're home alone regardless of their age, or they've had other struggles. Check in with folks, take that extra time, and be social from a distance. I think that's the most important thing that individuals can do to really help flatten that curve, which is so important. We're out of time. Thank you, Dr. Friedman, for taking the time. I know you're very busy, and I appreciate that you spent a little time with us. Folks, if you have any questions, you're always welcome to call me or email me. 617-872-8921 is my telephone number. Tommy.Vitolo at mahouse.gov is my email. I'm going to write it down and hold it up, but I can't do that and talk at the same time. I get confused.
Corbin, if you want
Here we
to open the chat window, we can actually also put it in the chat for people as well.
Yeah, so we'll do that as well. And thanks so much for being here. Thanks so much for watching. And thank you, Brookline Interactive, for really keeping our community together and sharing all of this information in such difficult times. Really an incredible community resource.
Thank
So
you
we're
very
going to
much,
sign off
everybody.
and next week.
Thank you so much. And Corbin, are we clear? I'm assuming we are, because I think he was listening along.
Okay, thank you. I'm gonna.
Thanks, everyone. I appreciate it.
Thank you. Happy to do
Take
it again
care.
if you need me to as well.
You well.
Okay, bye-bye.
Bye.